see Mayor McNally here too. Thank him for coming again. That kind of just emphasizes the importance on this epidemic and this problem that we're trying to rectify. So again, thank you. Thank all our partners that are here today to help make a difference. I think they're applauding you, Dr. Beck. Thank you. I want to thank the leadership at Mercy Health, in particular our foundation. I see Crystal Jones in the audience, and again all our other partners for helping take this on and improve the well-being of our expecting mothers and our babies. This is an exact congruence with the mission of Mercy Health as far as mind, body, and spirit. So the Centerin pregnancy model fits into our mission and what we stand for and what we're about. I want to thank our panel. And this is our steering committee as well. In particular, I'd like to thank Ellen Ford, who's on the end. She brought this Centering Pregnancy concept to us here at Mercy Health. In particular, thanks to Sarah McNicholas and Nicole Parrish. They've taken the lead on this for the past year, and it's a reality because of their leadership and vitality to make this program happen. So again, I want to thank you for being here today. We'll begin our program with Deanna Ford, who's the Director of Mission and Values. She's going to lead us in the opening prayer.
Good morning, everyone.
Good morning.
We do have our prayer in our program today, so if you'd like to pull your programs from your blue bag, you can follow with me on the minute. Today, with gratitude, we turn to you, God, to receive spiritual guidance, communication, and direction. In the quietness of our right mind, the place within us where our minds are joined as one, we listen to your voice with wisdom and truth, and we know what to do. Your understanding and spiritual guidance fills our hearts and minds completely. Your guiding Holy Spirit directs our every step. In all that we do, we acknowledge your holy presence and give thanks for the wisdom, strength, and serenity you give us. As we gather today, open our eyes so we have better vision. Guide our words so we speak good news. Strengthen our hands so we do the works of justice and peace. Move our hearts to feel compassion toward every person. For all these gifts and the blessings of life, we offer this prayer. Amen.
And just a reminder too, if you hadn't signed in at the end of the program, there'll be a sign-in sheet up here, and you can complete your evaluation and place them on the table as well. Our first speaker is Nicole Parrish. She's a certified nurse midwife and a certified nurse practitioner as well. And she's our program director for Centerin.
Hi, you guys. Thanks for joining me. I am at a Mercy Health facility in Youngstown right now, and they are doing their grand opening for their Centering Pregnancy. Centering Pregnancy, I'm sure you missed that, it's a group model prenatal care that the women come together in a support type of group, and they get their questions answered, and they get their exams and learn how to take their own blood pressure and things like that. And it really becomes a support group for the women, and it helps with birth outcomes. So what happens is that they wind up in a situation where they say to each other, hey, you weren't at our last month's centering meeting. Where were you? Did you need a ride? Did you need blah, blah, blah? And it really gives people the support that they need during the pregnancy, and it helps with the birth outcomes because then you feel more part of it, and your partners can come, your mother, whoever is your support person can come with you to the centering appointment, and then you get that private time with the doctor as well. So that's what we're doing right now. They're doing this is the first Centerin pregnancy program in Youngstown, so we're really excited about that. And I'm just so glad that you guys could join me, and I hope that you tune in and listen in on what's happening in the room. And I'm going to go back in. I just stepped out so I could tell y'all what was happening, because I know y'all like Centerin pregnancy. What is that? And it's a trademark, so it's a national group model. So as we go back in, I'll be quiet. Thanks for joining me.
Overall infant mortality in our state was 7.4 for 1,000 live births. And while white infant mortality was actually on target for the goals, Black infant mortality in our state remained alarmingly high. It was 13.8 deaths for every 1,000 live babies born. So this number not only is it alarming and high, it's actually more than twice the rate of white infant mortality. And because of this alarmingly high number, there's been a lot of support, all of you here today, but throughout the community, for a call to change. And in Mahoning County, unfortunately, our Black infant mortality rate is even higher than that state statistic. It's actually 16.2 for 1,000. So that is very, very high. So we must do something to address these unacceptable disparities in infant mortality in our community. Fortunately, like I said, we do have a lot of support from Mercy Health, from community partners, statewide and even nationwide resources to help strengthen our endeavors to end these disparities. In 2013, Governor Kasich announced several directives to combat this alarmingly high infant mortality rate. One such initiative is called the Ohio Institute for Equity in Birth Outcomes. OEI, it's also known as OEI, is a partnership between the Ohio Department of Health and CityMatch. CityMatch is a national membership organization with a mission to strengthen public leaders and organizations to promote equity and improve the health of women, family, and communities. This partnership between OEI and ODH and CityMatch included 9 communities in Ohio, and these 9 communities represented 95% of the Black infant mortality in the state. Mm-hmm. Unfortunately, like I've been telling you, Mahoning County and Youngstown ranked very poorly with the Black infant mortality, and because of this, we were selected to be one of these 9 communities. So locally, we've been meeting for the past almost 2 years under direction of the health department with several different community organizations. And we call our collaboration My Babies First. The M stands for Mahoning, Y, Youngstown, and the goal and the hope is that all of our babies in this community will reach their first birthdays. One strategy that's been widely used around the country is something called Centerin pregnancy. And that's been a strategy that's really been promoted by different organizations and even by our governor to help reduce infant mortality. And so this evidence-based model of prenatal care is what we're starting here at Mercy Health. And it's transforming prenatal care as we know it, really it is. It's reducing prematurity, reducing low birth weight, and increasing breastfeeding rates. And all of those things are known to directly impact infant mortality rates. Here at Mercy Health, like Rod said, we are committed to our mission and our promise to make healthcare easier for our prenatal patients in mind, body, and spirit. Our mission states that we extend the healing ministry of Jesus by improving the health of our communities with emphasis on people who are poor and underserved. We demonstrate behaviors that reflect our core values of compassion, excellence, human dignity, justice, sacredness of life, and service. And what better way to honor our mission than to be leaders in the fight against infant mortality at our very own Mercy Health Women's Care Center. Our hospital foundation has generously supported the development of this program. Throughout the past year, we've worked tirelessly with an organization and with our community partners, many are here today, to help implement the Centerin pregnancy program to target and assist those most at risk in our community. I'm excited to stand here before you guys today and tell you that our vow with the Centerin pregnancy program is to provide excellent prenatal care and support through Centerin pregnancy, so women who seek our services have healthy pregnancies and births, bringing forth new life to enrich us all. Our first group is actually scheduled to start in 1 week. We have a full group of participants already registered, both new patients and established patients. We've received an overwhelmingly positive response. They're actually genuinely excited to start this program. And
I'm confident that the Mercy Health Women's Care Center and our community and everybody out here is going to effectively lead this change and fight against infant mortality. I hope that as you learn more about Centerin and you learn more about infant mortality in our area, that will help us spread the word, and hopefully soon we'll be celebrating some successes in our community as we fight this battle against infant mortality. Thank you.
Our next speaker is Margie Rickel. Give you a little bit of background. Margie, she attended Philadelphia University's Institute of Midwifery, Women in Health. She graduated in 2001 and joined VCU Health